In this segment, Dr. Carlsen discusses depression in children and teenagers.
Now, can children become clinically depressed?
They can. Really, people from young children to the elderly can become clinically depressed. About 1 to 2% of young children, 5% of adolescents will become clinically depressed. It's even between boys and girls, interestingly, until adolescence, and then it becomes more common in girls than boys.
Why do you think that is?
There's probably a number, and there are a number of reasons for that. Certainly, one is hormonal. If you follow women out across the lifespan, they're twice as likely to become depressed as men. So, after being in the postpartum period, in the menopausal period with the change in hormones, that also impacts our neurotransmitters.
And going back to children, so they can become clinically depressed.
You can.
What can you do with a child who's clinically depressed to kind of nip it in the bud so it doesn't become clinical depression as an adult?
Yes, and thankfully there's a lot we can do. We can do talk therapy. There's a lot of data for that. So either cognitive behavioral therapy, interpersonal therapy, get them moving. Right? There's a recent study that was out that active children have lower rates of depression. Nutrition is huge. So get the bad stuff out and put the good stuff in.
Do you think sugar makes us depressed?
I think sugar is bad for our bodies and bad for our brains. And our brains and our bodies talk all the time, right? There's really no separation between the two. For children, family therapy is really important. So making sure that there's good communication, that the conflict is low, that people are connected to their children. All of that is really important. There are some instances where medication may be appropriate for children and adolescents, but it's not the go-to recommendation, and it's not a standalone treatment.
If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.